Hi, my name is Bruce Bassi, and I'm a psychiatrist with Telepsych Health, and I'll be talking today about how to talk to your loved one about addiction. Now, everyone's situation is going to be a little different. You obviously know your loved one the best. You may have tried to speak about addiction before and have been met with anger or aggression or a lot of resistance. And so, if that's the case, maybe you want to approach the situation with a professional and don't put yourself in harm's way. You want to trust your gut, and if the situation's not right or the timing's not right, then maybe it's time to put it off to another time. Now, the thing is, there won't be a pleasant time to talk about addiction. Addiction is a very tough topic, it's a very sensitive topic, but you want to set yourself up for success. You want to maximize the opportunity for your voice and opinion to be heard and to sit down with your loved one in a non confrontational manner that won't make the person feel judged or misrepresented or like you're attacking them. If you choose the right timing, you'll allow the other person, your loved one, to save face and also not become defensive. That's a very common reaction response to talking about addiction. You're essentially talking about the individual's defects, and it's a usual response for people to become defensive about this. Secondly, you want to understand the perspective of the issue. The treatment of addiction is lifelong, and so they need to be on board. It can't feel like you're just imposing your viewpoint and your treatment plan on them. The change has to come from within the addict. You want to ask yourself, what does your loved one see as the problem? What do they feel like they missed out on before their addiction started? Also, keep in mind that there are many different treatment options. So you want to offer your help in ways that they would like without dictating what they must do. Thirdly, when you sit down with your loved one, you want to show empathy but also be assertive. You can still accept the addict as a person even though you don't accept their behavior. Their behavior and their characteristics as a person are two different things. Understand that you can feel multiple feelings towards somebody at once. You can love them, but also feel completely frustrated and fed up with their behavior, and maybe even feel really hurt by them. The fourth tip is that you want to choose your battles. You want to stratify what's most important to you to convey to that individual. When people become very defensive, they don't really even listen to what the message is exactly. You want to stratify what is actually most important that you want to convey to the other person. Now isn't the time to go through a laundry list of grievances and character defects that you've accumulated over the years. You won't want to bring up that the individual didn't go to your mother's birthday party 5 years ago. Certain requests might mean a lot more to you than others, but if you bring them all up at the same time, it might be harder for the other person to differentiate what means the most to you. The fifth tip is that you'll want to have some treatment options set up. You'll have to remember that there's never going to be a convenient time to go into treatment, so the other person will inevitably think of some excuses to not go. However, if you've already done your homework and you know what treatment options are out there and you've already researched them and talked to other people who went through them, it'd be a lot easier to convince the other person to go into these because that fear of the uncertainty, unknown, is a big barrier for most people. But if you tell them what it's going to be like and that you're there to support them every step of the way, but you just want them to get treatment, it's going to be a lot easier to convince them to go. So let's review. The first step is to find the right situation, the right environment to talk to your loved one. The second step is to understand their perspective of the issue. Everybody comes to these sorts of situations with different perspectives. The third step is that you want to show empathy yet be assertive. The fourth step is that you want to choose your battles and stratify what is most important to you and not bring up a list of grievances. And then the fifth step is to have some treatment options in place and come to the table with some recommendations and having already done your homework. We hope that these 5 tips were helpful for you to starting that conversation with a loved one. If you find resistance in talking to your loved one about addiction, we recommend that you bring a professional with you or meet with a professional beforehand. Thank you for watching this video. I'm Bruce Bassi. I'm a psychiatrist with Telepsych Health.